We'll officially welcome everyone to our COVID-19 Webinar Series. And today we're talking about, this is more of an open discussion with all of you today, kind of a different approach than what we've done in the past. Really, this is about your most valuable lessons from the COVID-19 pandemic. So a bit of looking back. So we'll start in just a moment with some opening remarks from Doris, and then we're going to open it up for discussion. So your most valuable lessons from the COVID-19 pandemic. And
given the numbers, Susan, that is really excellent because it keeps going up. Are we going to do breakout rooms a bit? I think will be nice.
Yeah, I think with this, we're on we're not on meetings. Meetings allows us to go in a breakout. So in order to make breakouts, we'd have to disrupt the webinar. Yeah. Yeah.
Okay.
Yeah. So we can certainly, I can put up a whiteboard and we can do that, as well as having a discussion. That can be also interesting. So we'd like to hear what your most valuable lessons are for yourself, for nursing, and for health. So looking at 3 different levels, and then we'll have a discussion of where we go from here and some calls to action from RNAO in general. And I just wanted to make it really, really clear that this session is being recorded. We want to make note of what is discussed today, because this could inform some future writing that we do on this topic. So we want to make that really clear to you. And also we might be tweeting during the session as well, because we have members of our team who are able and very skilled at doing so. So just wanted to start, Doris, start the discussion off from you. And this is a little bit of what you spoke about in the recent RNJ, some of your reflections and what we're looking at the profession and COVID-19, and just captured a few of your thoughts on kind of how things went with the first wave, second wave, and the last 2 waves. So I'll turn that back over to you.
Thank you so very much. So, first of all, as we were going along, I was like many of you, 24/7 without a minute to stop and reflect, more often than not. And I mean it, 24/7, especially first, second, and third wave. In the summer, though, I did have a little more time to pause and try to reflect what was happening to nursing overall. I must say I haven't had a lot of time to reflect what's happening to Doris, but to nursing, yes. So to your 3 questions, Susan, about with you, with nursing, and with healthcare, the last 2 years, the first, maybe sometimes at some point I will start to reflect more, but I will tell you why I haven't had time also, because that may help others. But let me talk about the profession and what I see happening in nursing, and what I see that is very good with that, and also what might be areas of concern. So during the first wave, no doubt in my view that our profession and nurses by and large, and I would say the public also perhaps, that phase was characterized by fear. I mean, you may remember, even now, if you go back to our webinars, cleaning the naps, and, if a package would come, you would either not touch the package or leave the package there, like in isolation for some time, like, you know what I mean? And the fear also of bringing for staff nurses in the front line, especially, but not only staff nurses, others, and that may explain sometimes the jumping in the queue that happened, as you may remember, in some hospitals to getting the vaccine when you were not frontline, that RNAO criticized at the time. I think that was characterized by fear. People were afraid of getting the virus and bringing it home. And if you layer to that sectors, long-term care, this dramatic fear was justified. was justified. Guys, they didn't have enough PPE. At least in hospitals, they were prepared with PPE. So the fear and yet the need to respond, right? No one gave up. No one said, I'm gone. In nursing, I'm talking. And people kept going to work, many extra shifts, etc., etc. When you look at the second phase, I would suggest that that's when at least I started to see moral distress. I saw that also in the first wave, but people were so rushed to respond. I mean, I tip my hat for everybody. So rushed to respond that they didn't even have time to stop and think. So they rushed to respond. They were fearful, but there was no mistrust. I think that's a bit of the word. I think when they started to realize the dynamics in long-term care, I think the dynamics that happen and the realities that happen in long-term care really had a dramatic impact on what happened on the second wave with moral distress and relentless. You know, people were, restlessness. People were distrustful of public health measures because usually they came too little too late, if you remember. People were distrustful that the decisions were based on the best evidence versus politics. People were outraged of what was happening in long-term care. And I mean people, everybody of the health professions, everybody of the public, it really spilled over everywhere. If that second wave in relationship to long-term care would have gone better than what it went, probably we would have done overall better in Ontario. The third wave and the fourth, I would say that in relationship to healthcare, one good thing happened and was the change in Chief Medical Officer of Health. I think Dr. Kieran Moore brought new hopes and a clear, for some of us at least, understanding that he will have more capacity to make the right decisions and to convince the Premier of upholding and following the right decisions. And if you look at it, you can see that that was very helpful related to the health system, as the third and fourth wave have gone much better than in other jurisdictions in Canada, Alberta, Saskatchewan, New Brunswick now, etc. And I think if you heard the throne speech today, which is why I was a little bit late because of interviews, that message today was we are staying the course. We are not reopening willy-nilly everything, we are staying the course. And that's a welcome message. And I think both Dr. Moore has had a lot to do with that. I think the Premier has come to a different level of understanding and maturity about public health measures in relationship to also vaccine and public health measures, the combo. And when I think myself, well, why in this province things shaped, including the change in Chief Medical Officer of Health as compared to Alberta, that should have happened too. And why is it that the Premier here is upholding more, both changing the Medical Officer of Health and also the measures? I would credit, not in a small degree, RNAO. RNAO was very vocal. For the most, very well supported for it. Sometimes people were not happy that we were calling for resignation of then the Chief Medical Officer of Health, Dr. Williams, but all in all, we would have been in the Alberta situation if that would have not been the case. So we did right to the profession and to healthcare. What happened to nursing with the third and fourth wave, and in particular with the third, is critically important. What we are seeing is an uprising of the profession. as I wrote in my column, and you can put a link, please, Susan, if you may. I think that the uprising of the profession is welcome, very, very welcome, with exceptions. And I mentioned the exceptions in the column because it's bringing the voices of frontline nurse leaders, frontline nurse leaders. And we better reshape the way we are talking. Leaders are not only the Morgan Offord, president of RNAO, the Doris Grinspun, CEO, or whoever at ONA, or whoever at the college, or the chief nurses only in organizations. But frontline leaders are in a major uprising, and it's a welcome one because it's about issues like staffing, like the number of RNs that we have, like the workloads, like Bill 124, which must go, etc. There are exceptions, and those exceptions, I will, in purpose, not name them by name, but the exceptions are those that organize the very few fringe nurses that organize rallies against lockdown, against this, against that, against the other, against vaccination, in front of hospitals, etc. A disgrace to the profession. That's all I can say. And no, I have asked the media that if they want to interview me about that, no name for those people or for their group, because you only give them legs. Instead, I want to highlight new groups, Nurses with the Sign, that today they were at Queen's Park in a rally, and yesterday too. The other ones, Nurses United, same story they did together. And many of the others that you have seen ongoingly, right? That go to these events, that speak at these events, that are very vocal in the social media, whether it is Brigitte or Deborah or many others, right? That are speaking eloquently, Heidi, many eloquently in social media with evidence, with character, with courage, without fear that they will, you know, the fear that nurses used to have, they will fire me. There is no such a thing. And RNAO stands with them and will continue to empower them, because together, the formal nurse leaders in organizations and the front line will, with RNAO and other groups, help change things for the better in the future of our profession, and by extension in the futures of healthcare. I want to put a word of caution on some recent tweets that I have seen blasting some middle managers or chief nurses. Let me be very clear, guys. I will never retweet something like that. I rather want to hear about the many chief nurses and middle managers that have done outstanding, that are role models for the rest, that work together with their staff, that do not discriminate, that do not treat people with disrespect. The same as I don't want to highlight those that are doing rallies for the wrong reasons. I don't want to highlight those that are not practicing, regardless of their role, at the top of what excellent practice needs to be. I rather build on the strength, because we have much, much strength, and then continue to fill the gap, building from strength to strength. That's the RNAO motto. It always has been. Yes, there are times when we need to blast, but if we are going to blast, have the courage to put the name, because if not, every other nurse feels awful. And nurse managers, middle managers in particular, I would say, have had a very tough, right, push from all directions, but also chief nurses, also educators, front line for sure the hardest of all, and RNAO too. We are all on this together, and I think we will come out of it, I hope, stronger. I hope more united than ever. I hope more united than ever. And let's keep going. Nurses' willingness to go on record with name, because they tweet with name on critical issues to raise the voices and to raise public and media awareness through social media is revolutionizing the profession, and kudos for it. So I will stop there on my reflections, and more will come. But I think that's it. You know, I will not comment. Well, let me comment a little bit about what this has done to me as a person. Certainly has not done anything to help me keep work-life balance. I never had it before. I don't have it now. Hopefully at some point I will learn from others. But this had let me appreciate the good and bad of social media. Yesterday, I was privy to attacks on people, as it happened to me on the past, but people that I care deeply, and I intervene. Social media is a difficult medium. I think 30% it brings the best of people. Honestly, 70% it brings the worst on people in terms of attacks, in terms of the way things are discussed for no reason sometimes. And I think that's where I would like all of us also to pay attention. And when you see those things, nip it in the bud. Nip it in the bud. Let's have the courage, because social media is not going away. Well, maybe it is. But I don't think it will. And we need to act and take the baton of defending people that are attacked, whether nurses or others. This was on the issue of vaccination. Are you being vaccinated? Do you want, you know, no place for those attacks. Ask the question. People don't need to be there every minute to answer, and let it be. If someone else answers, so be it. And like that, I have seen many attacks on non-nurses too. We need to nip it in the bud, because social media has challenges. So I will stop there. I do need to say that since I had the privilege to work with the team, but it's not something I didn't know, right? That was fabulous at RNAO, that was always ready to do more when needed. Colleagues in the field that were connecting, the media that was both incessantly with big appetite, but also the media was tremendous this time compared to SARS. It was so extremely responsible and responsive that kudos also to the media that not always gets those kudos. I will stop there, Susan, thank you. And we have a beautiful number of 65 people and keep growing. So let's hear from others.
Yes, great. So you're welcome to, I think we'd really most rather hear your voices, and you can put your hand up and answer these questions. I think we'll start by kind of one question at a time, and we'll see how far we get with that. So we'd really like to hear what your most valuable lessons are from this pandemic, all this time for you personally. Let's start there and see what comments people have. And again, we can allow you to unmute your line, and you can also write in the chat, but we would like to hear your voices and hear your thoughts on this first question. So let's see. Yeah. Olivia is saying here in the chat that you can let us know if you'd like to participate as a panelist as well, and we can put your camera on. In fact, I'm going to put my camera on, and anyone else who wants to put their camera on,
that's lovely
to do so. So this feels a little bit more like a discussion. And in fact, I think we know what the questions.
Take the slide off.
I'll just turn that off. Yeah, because we know what the question. We know what the question is, right?
I say, why don't we focus, because it's the most difficult, I think, on the impact on us. Honestly, it's the most difficult, you know, I think. On the profession is so public, the impact, right? And on healthcare is so public too. And guys, remember, we are not done. We are not done. I think that's the biggest reflection in the last few days for me. We are not done. And this is so long. When is this going to be over? And cannot. I used to be able to say to my team, oh, it will be over in. I can't say even that anymore. I think we are doing better. I think we will continue to do better if the Premier and Dr. Moore keep focus. But we are not done. Until the world is done, we are not done. Barb, you want to make a comment?
Hi, everyone. Are you starting with the impact on the profession?
No, on us. How about us as people?
Oh, personal.
Speak anyway.
Any way you want, Barb.
Yeah, no, I'll start with the personal. I think what many of you know that I was a CNS during SARS, and I was in quarantine a couple of times. So kind of bringing that experience, and with the pandemic, I've been retired. So I've worn volunteer professional hats. So I've been involved in nursing quite a bit. But on the personal side, I've done a lot of things that bring me joy. I am really blessed to have a big, huge garden. And early in the pandemic, my friend and I built a deck off the garden room, and I just spend all of the beautiful season outside. I have a veggie garden I put in for years. I relearned how to can the last 2 years and put down my produce. I took art lessons, many art lessons, different mediums, different teachers. So I've kind of developed some skills with art. And I play a trumpet. I played a trumpet for years, and I really miss that. That's been maybe one of the bigger losses, personal losses for me, because it's something that really gives me a lot of joy. And who would know there'd be no band for 2 years plus and still going. So I joined a virtual choir with my daughter, which has its own challenges, but I've been learning to sing and learning to sing alto, and we're working on pieces of the Messiah. So really pushing myself. So just what it's bringing me some joy, because it's just a terrible, terrible experience on many, many levels, with a great deal of distress and sadness. So yeah, whatever we can do to bring some joy into our lives, I think it helps keep us resilient.
That is so beautiful, Barb. Barb, do you have time to or can I ask you to share some of that on the Twitter? You do tweet, because
yes.
You know, there is that is missing, I think. People bringing the silver linings that sometimes some of them are good. You know what I mean? I think it's so important to bring hope to people and to bring balance, the yin yang, to bring a bit of, it's not all gloom and doom.
And actually, I just wanted to mention that I believe it was the knowledge keeper at our AGM who said, if COVID has not changed you in some way, then you truly have not been reflective and insightful about the entire experience. So Barb, I'm just, I've kind of paraphrased that, but I'm just thinking that you absolutely have embraced the experience for sure. And it seems to have changed you in terms of finding joy in many new ways.
That was beautiful, Barb. Do we have other people that want to make reflections? Now we need to put in context that, just so frontline nurses don't feel that they have not reflected, that is a different reality when someone is retired and has the opportunity to do the gardening and the reflection versus someone is, you know, in the middle of the battle, in the front line, whether it's as a staff nurse or as a manager, etc. So just to put in balance, because I see we have everybody here involved. Beautiful. Anybody else that is in the chat that would like to share or is willing to share? We have lots
Nicole will allow to talk, and also you're welcome to put yourself on camera. Nicole, please go ahead.
Sure, I can't see how I can get on camera, but I'll speak anyways.
Thank you. I think Olivia can promote you shortly, but go ahead and speak, please.
Oh, there we are. I am half, can you hear me?
Mhm.
Yes.
Yes.
I am kind of a half and half person because I work casually. So I have been in the hospital, in the NICU in Credit Valley sometime, and did experience the fear that Doris talked about in the beginning. But we soon became closer as colleagues and worked together to be sure that we all felt comfortable in how we were how we were practicing and how the people around us were practicing. I think we've all had some time to appreciate life, and I've had a chance to appreciate my family members who I didn't see for a while and then started to see. I appreciated the nature that we have in Ontario because we have so many beautiful places to walk. And I've actually not on purpose lost some weight because I've hiked so much, and developed some new cooking skills, and also starting to learn to play the piano.
Wow. You are going to do the band that Barb wants.
Sure.
No kidding. I'm serious.
And I was able to play singing within my choir in Mississauga. We're a 180 voice choir, and we're able to sing via Zoom and record from home. So some new recording skills to learn. And why I learned to play the piano is it's hard to learn to sing a piece when you're playing the flute, because that's my instrument. I play the flute, but you can't play the flute and sing at the same time. So the piano has come in handy for learning music. But I think that most of all, nature, I've been able to appreciate nature and my immediate family and friends. But thanks so much.
And where do you live, Nicole?
I live in Milton.
In Milton. No, I am serious about this idea. Yeah. That maybe we will call for volunteers and we call it the COVID Nurses Band. I am serious. I'm deadly serious. Can you imagine a few people that play instruments and want to sing?
Yes.
Doing that at the future AGM?
It would be great.
A silver lining of COVID, and then between Barb's garden and your new cooking skills, maybe we do something else. Me too, by the way. Me too. I planted a lot of things because I could watch them. Like I could take care of them in between things.
We could have a song to promote one of our causes. Anyways, thanks for listening.
That's beautiful. A song.
That's the thing, you never know. You never know what's going to happen with these webinars. Thank you so much, Nicolette. And I think Javier was going to speak next, and then I think Marianne might have been on. Okay, go ahead, Javier.
Thanks, Susan, and thanks for sharing, Barbara. I just was thinking similarly for myself. I've also learned the importance of reflective practice. I think this is something as a nursing student we practice a lot and focus on, but I truly didn't learn the importance of it until the pandemic. So taking the time to reflect through various methods such as peer support, journaling, painting, to really start to measure the impact COVID-19 has had on us individually and also as a community. I know at the hospice that I occasionally work at, we've seen the importance of having virtual debriefs. So we've been doing monthly virtual debriefs because we've really been missing that peer support and the casual and occasional debriefs that we engaged in prior to COVID.
That's beautiful. That's beautiful. Well, your life, Javier, has changed significantly during COVID. Share with people what happened.
Yeah, so during the first phase of COVID, I've changed roles since COVID in the first phase, but I also experienced volunteering at long-term care homes. And as I mentioned earlier in the chat, I think I've truly started reflecting on that experience now and taking that in now. And again, through chatting with peers and things, because I think we were in so much shock and so much fear around the experience that we didn't truly get to process the impact it had on us as a community as well. So that's something that reflection, again, is very important. And since then, I have learned, and through the help of Doris and our team, how to really raise my voice around things such as that and join the RNAO now. So
and she works at RNAO. So that was a silver lining for us. Your gain.
Thank you.
Thanks, Javier. Marianne, were you going to speak?
Hello, yes. Can you hear me?
Yes, we can. Thank you.
Yeah, thank you for all the comments and the opportunity to come together as a community around impact on myself personally. Just two things. I want to really echo Nicolette's comments around nature. I think it's largely realizing how much I've taken for granted. That what we have around us environmentally, my own inner resources and so on, and how much my professional aptitude is intertwined with who I am as a person. So that nursing seems to be in every fiber of my being and vice versa. And how grateful I am to be a nurse. Yeah, those are the main things. And as people have said, I would agree with resiliency and just the teachers, I guess, and mentors I've had along the way, where I do feel confident to speak out and speak up in a graceful, courageous, as Doris, again, to echo and underscore Doris's comments, fashion. So yeah.
Marianne, where do you work?
Sure. So I work.
If you want to share, if not, don't.
No, I don't mind, of course, yeah. Thanks for the invitation. I work in the community as a nurse entrepreneur under the umbrella of association-wise case RNs, but also I've had the benefit of connecting with, through RNAO, Special Interest Group, independent practice nurses, which has been a help, yeah.
And have you had work during the pandemic?
Yes, I have. You know, I've been careful about the environments and so on, looking after ourselves as well. But yes, I have, so I'm glad for that.
That's great. That's great.
Thank you.
Thank you for sharing. I like the idea. So take Susan, nurses and hiking for real. I'm talking real for post-pandemic. Even not post-pandemic, we can create groups. Nurses and hiking or nature hikes, or someone put it there, is fantastic. And the other for real, a choir. I can see Raul taping the choir already and putting it. And I like the addendum that Nicolette said for one of our causes. Just imagine if we do something on Bill 124. And by the way, Brigitte, who is one of the ones that pushes for Bill 124, amongst many others, and RNAO, she sings too. Okay, I have it ready. Raulito, remind me, I will put Barbara, Nicolette, Brigitte. We need two guys, so just to put some balance in the thing. And you are going to tape them singing like the I will belong to the raging grannies when I'm at some point in my life, but they can sing something else. It will be amazing.
I did it last year for I follow there's a Hispanic senior group, and they knew what I was doing and they called me to do that. And it took a long time, a lot of work, but for Christmas, it turned out beautiful. So yeah, we can do that.
This is more urgent than Christmas, because otherwise our poor colleagues will be raging in the street nonstop until the premier listens, and maybe through a song he will listen more.
Now, Doris, this singing group or band, is this, you were talking about grannies. Were you thinking
no, that's the next iteration. That is the one I will create at some point in my life. Raging grannies. Have you ever heard them?
Yes, of course. Yeah.
Oh, they're amazing.
Yeah.
No, but this is for real, this one. I think it would be really good. It will be really good. It will catch attention with the media. It will push the issue, and it doesn't need to be only about that. It can be, they can develop their own repertoire later on, of course, Barb already is trying to push herself on one so she can lead the show with Nicolette and others. But I think, honestly, if we could do something on some of the issues that we are pushing, like we are using a lot of new modalities, right? It could be very impactful.
Yeah, it's very complicated because with our choir on Zoom, there's lag time. So when we practice, we're muted because everyone's lagged. So you don't get that combination of voices. And we did a virtual song. It's a huge amount of work to learn how to videotape yourself and to sing your part solo with a track in one ear. So you're hearing that you're on pitch with your other ear and getting everything perfect. And then the choir director has specialized software to do the mixing. So it's quite complicated to have the song produced for the quality you want for going online.
It may take a little time, but it can be done.
Yes,
so
it can.
Raulito will help.
It can be done.
But Barbara, I'm glad you are explaining, because when we hear them, these choirs in the television, we think, oh my gosh, how
they're fabulous. It's really fixed up with this software.
So one of the colleagues just wrote, I think Nicolette wrote on the chat, that there is this nurse in Ottawa, and I know who is the nurse because I tweeted about her. Raul, remind me. She sings to patients, so she can be another person to the group. No, really, this is nice. This is great. Very good.
And we have the new RNAO uniforms they can wear.
Did you see the video yesterday from Lamo with the uniform? She looks a million. Do we have other people that want to comment?
I don't see anyone's hands up, but let's just, let's see. Just a hand went up now. Maybe Olivia, you can help me see who that is because I'm not seeing it for some reason. Oh, Maria, you can please go ahead, and if you're able to and want to come on camera, that'd be great as well.
Okay, so can you hear me?
Yes, we can. Thank you.
Okay, yeah, no, well, I'm retired. I'm here alone, and I've been doing the same thing as the other girls. Learning new recipes to cook. It's like, especially when you have to cook 3 meals a day for yourself. And I've been enjoying my gardening a lot more than I've ever done, but mostly flowers, not really vegetables. And there's a park nearby that once you get into it, it's got the, you feel like you're out in the country. So I've been enjoying that now. So that's what I wanted to sort of say that.
That's beautiful, Maria. And what are the dishes you prepare? Now that's the other thing we can do, guys. We can do a cooking book.
Well, I was doing more baking. Like I like to do loaves instead of muffins. So it was either blueberry loaves, a zucchini loaf, or that type of thing. And then some mixing apples in with whatnot. And then I like more soups than other dishes, and so vegetable soups and whatnot. But I think just recently, I think it's time for me to leave the coop here. So I joined the AGO, my annual membership. So I booked to see the Picasso display at on the 17th of October. I said, well, it's time to sort of get back into
That's good, Maria. That's fantastic.
Thank you. So I'm hearing 3 potential groups. One is music or choir. One is maybe a nature walk, and one is something about cooking or recipes, a recipe book or something like that.
I joined that one.
Yes. Yeah. Heather's got her hand up too.
Okay, here you go.
Yeah. It's like ways to connect, ways to uplift one another. Good for our mental health, and just strengthen our nursing identity in new ways as well. So sounding good. So I'm thinking maybe we should move on to the next question and looking at how the nursing profession, our profession, and how COVID has impacted the profession. So again, we'd love to see more of your pictures up if you want to be promoted as panelists. It doesn't mean that you have to speak, but it would just be nice to see more pictures of people and your faces so that we do feel like this is more of a conversation. So we can certainly promote you. Just say, I want to be on camera. Great. Thank you, Maria.
Okay, yeah, I thought I was on.
Great. So, and you can put notes in the chat or unmute your line. So the question is your most valuable lesson from the COVID-19 pandemic as it relates to nursing.
From your observations, right?
Yeah, there isn't a specific right answer we're looking for. It's your own perception.
It's Barbara. I'd like to go. I'll try to be brief. I'm president of the Canadian Nurse Continence Advisor Association. It's a specialty nursing association under the umbrella of CNA. And early on in the pandemic, we conducted a series of focus groups with our specialty nurses across the country to understand the impact of the pandemic on their clinical practice and to identify what they need from us in terms of support and how we could best support them. And the nurses across the country have had a different experience. Our nurses in the eastern provinces, for the most part, have continued to have their clinics. But many of the nurses in Ontario and Alberta, their clinics have been temporarily closed, maybe closed for the long term, and they've been deployed into acute care. Big shifts for some of the nurses from a pelvic floor clinic to being an RN helper in ICU. So very stressful. We've been gradually moving to more virtual methods of connecting our nurses across the country. The pandemic really pushed us to go virtual and with different platforms. So we're using Mobilize and we're using Zoom, and we've been offering monthly education for our nurses. Good uptake live in these Zoom sessions, and many more nurses taking advantage of the recordings. And what I think the key learning is, I think with my different hats, the art, the music, and nursing, is people love this connecting virtually. It's easy, it fits into your life easier, it works for people, and nurses are asking, let's keep this going. It's something that you don't want. There's a lot of these things we don't want to see end after the pandemic, because there's just different aspects that have made life easier and more accessible to connecting and learning new skills, virtual methods. So I think that these methodologies are here to stay and maybe be enhanced more. So that's what I wanted to share.
Yeah, we hear the same in terms of keeping the virtual. Yeah, it also, even in political events like Take Your MPP, etc., it has democratized participation because more people can join. Yeah. We have 66 people, guys.
Yes, let's hear more perspectives. Marianne, you're saying it's been great to appreciate the experiences of nurses from all around the globe. Can you say more about that? Is that through virtual means, or what are your thoughts there?
Exactly. So it's just in follow-up to the virtual connecting and really appreciating. I hadn't before both the pandemic experience and the immune vaccines or lack of vaccinations in different countries. I've also attended some of the World Health Organization conferences, online events. It's very eye-opening for me. Plan to continue, yes.
Great, Marianne. Thank you for sharing.
Can we hear a bit more about, I saw in the chat earlier, people talking about being on Queen's Park, and Doris had mentioned that, you know, she's really noticed the voice of nursing being more vocal, more recognized. I'm just curious if that's been an experience, sort of a takeaway for some of you who are on the call. If you feel like you do have a louder voice, either in your own, you know, personal network or families or publicly, like, do you feel like the pandemic has raised given you maybe a platform to raise your voice more than it has before?
And I would take it with an augmentation, even as you said, within your family, by the fact that you are a nurse. I think I mean, I noticed that in general, but even more so, what's your view on, what's your opinion on? It will be interesting to see if other people feel similarly within their networks, their families, their friends, etc. So not only the voice in terms of, you know, about bills and about etc., but about what to do in life, right? With this endless pandemic. Any takers? I will fill the gap until someone puts the hand. You know that was a theme in my back then dissertation. My dissertation was about the social construction of caring in nursing. And one of the themes became nurses as women and as family members, the balance, the good and the bad, meaning the burden and the benefit of it, right? In terms of status of women as nurses within the family. It was very interesting. I'm pretty sure probably during the pandemic, many nurses and doctors for sure too experienced that in their own families. I think we have a comment or a voice there. Seawood, who is Seawood?
Connie?
Connie.
Oh, Connie.
Connie, please unmute your line. Come on camera. I'm promoting other people to panelists or offering them to become panelists. You can just accept it so we can see more pictures here.
Go for it, Connie, share. Oh, look at that. I have seen where RNAO voice is highly respected and heard. This summer I was a patient and I was thanked profusely by a nurse, I'm assuming, well, I know because you told me, Connie, so I am going to fill the gap there. By a nurse for the RNAO blog. It was the only information. Here it is. These nurses receive at first. Yeah. Yeah. That happened also with many people around the world that thank us profusely. If you remember at the beginning, it was pretty tragic. Even chief nurses were not involved in the plan. Things evolved so quickly, right? And so fast and so stressed that not always they involve our colleagues, even in organizations. And that's why, Susan, you may remember, we transformed the monthly meetings or whatever it was that we had related to health system transformation to COVID meetings. But similarly happened with health system transformation, if you remember. So there is a pattern to think about. There was also in health system transformation with the OHTs, not always they involve at the beginning our colleagues. So something to watch for. Oh, Connie. Connie, you look good. You look good as always. Good to see you. Go for it, Connie.
Yes, I just really noticed how the nurses who cared for me really valued the voice that RNAO was providing for nurses. And even though I'm an employee here, you know, there as a patient, I felt very, very proud to be part of that and to see how much they valued the blog that RNAO was providing and telling me that this was the only information they had received at the beginning of COVID. And it really showed me how important our work is and how strong our voice needs to be to advocate for nurses. So thank you to all my colleagues that do all the great work.
And thank you, Connie, because you were a big part of that work too, especially when things were going so difficult with long-term care in the first and second wave. The long-term care coordinators, which you're a shining example, did huge amounts of work, right? So thank you, thank you.
Great to see you, Connie, and thank you. I see that Nancy, you have your hand up, so I think you should be able to speak if you unmute your line. Okay, we can give that a little bit of time. And any of you are welcome to unmute your line or come on camera and focus on right now the impact on nursing. So if that's about having a louder voice, a more respected voice, I see in the chat that this is, well, Javier, you had put this, addressing misinformation and hesitancy with your own extended family. And I've certainly had that as well. And practicing communication and education strategies. That's certainly been a really important role. Naomi writes, I have my mother in a local NH. She lost half of her weight during the lockdown. And this, the days are running extremely short staffed. So nurses are really burnt out and exhausted. Yeah, I think that's really the reality, Naomi. Thank you. I just asked a question about speaking out, and now there's no speaking. So I'm wondering, oh, Heather, go ahead.
Sure, I'll just share that, you know, I've found that this past year and a half or a bit longer now, you know, I've definitely seen more of my friends, colleagues, and family asking more and more about what's happening in healthcare and nursing, asking for support and advice. I've also found it's been challenging sometimes when I had to be the bad guy and say, no, we can't do that. Or, no, I really think we have to hold firm here and not do, just because everybody else is doing it doesn't mean that we should be doing it. So I'll be honest and say that that's been an interesting balance of trying to find, you know, sharing the truth, the honest results, the evidence, what the plan should be in the go forward, and trying to navigate while everybody else is doing it, why can't we too? So that's just a personal reflection. That may not be so much about the profession, but I suspect it probably is true of many of those on the call today.
Yeah. Thank you for sharing, Heather.
Thank you, Heather. And I know that I've certainly had some very difficult conversations in my own family as well. And sometimes there's some divisions, and that's difficult to navigate on a personal and also professional level. Kelly is saying that she works in an Indigenous community, and the one positive thing from COVID is she feels like she got to know many of the members of the community that she wouldn't get the chance to meet otherwise. So thank you for that, Kelly. And Marianne is saying that many of us have been made to feel valued by members of the public. Has anyone encountered harassment, I guess, or challenges by members of the public, and how you deal with it?
I think I'm the flag for it. The flag, whether it was about the lockdowns, whether it was about the masks, whether it was about vaccines, but that comes with the grain of pride. You know what I mean? The fact that RNAO was seen as so influential. At times I would call Marianne and I would say to Marianne Zich, our director of comms, or to Morgan, I would say, they really think that RNAO has the power to do this? And sometimes they answer, yes, it does. But you know, the fact that the public put us in one of those very heavy duty attacks, they actually, and the person was a well-known person, said RNAO is one of the 3 most influential organizations. It's one of the MPPs that the premier kicked out, said, watch RNAO. It's one of the 3 most influential organizations shaping this province. Well, good for us, guys. Good for us, because we are going based on the best evidence we have at the time, you know? I mean, that's all we can do in a pandemic. There's nothing else we can do. The moment we lose that compass, right? Then we become politicians, but we're not. So the public, yesterday, someone in this attack that they had against one of our colleagues about, are you vaccinated? Are you vaccinated? And by the way, she is, but she was not answering because she probably was busy in life, right? Like Sunday, okay? So one colleague answered, yes, she is. Well, I didn't ask you. Then I answered, most nurses are fully vaccinated and we take it with pride. And the fact that you are asking so much, I understand that you hold nurses in the highest trust and we take it with pride. But please understand, nurses are very busy and this individual may be busy too. And then the person answered, I didn't ask you also. But honestly, like, do people think that colleagues that are working 12 hours? No, really, this is the piece, is unfathomable. 12 hours, then going to a rally, quite frankly, against Bill 124, right? Then coming home, that they need to be answering in the minute the question in Twitter. You know, sometimes we need to remind the public, whoever is the person, have some compassion. Just have compassion. Say thank you and answer to me whenever you have time, you know? But it's like this, right? Social media is like this. Got to answer, got to answer. In any case, yeah, you said reflect on your personal. I need to say, Heather, thank you for saying what you said about family, and to Susan, because I experience, I would say, the opposite. And that's not always the case in my family with my kids, you know, when I try to give opinions about whatever, it's not a reunion, which is very welcome, I learned that. But on COVID, they were on the dot, like I was so, brings me to tears. And I was therefore careful, right, on what I would ask and say, because they were like honestly listening to every word. So I thank you for allowing me to have that reflection. I need to tell that to them. That is not a reunion, but during COVID, apparently it was. Thank you. But it becomes a burden, right? Whether they don't listen to you, your family is a burden. And if they listen too much, you take it really very, and it happened to me with staff too, guys. I knew that staff and people, we have 67 people here and not all our staff. So let me share that staff. We met, once a week or twice a week? At the beginning, twice a week even. They really were eager to hear not only where we stand with things, but how should they conduct their own lives. And also that we took with a lot of responsibility of finding the answers, but super proud of how staff really were amazing. Staff were amazing. I mean, touch wood, right? Were amazing.
I'm curious if people have other things to say about how we've been perceived. There is a note in the chat box about from Raul about kind of overuse of the word heroes. Some people are feeling like there's kind of maybe attacked, standing up for what's right within your family and others. So any other thoughts on that in terms of perception of nursing and how the public is seeing you or your family is seeing you? Go ahead, Mark.
Mark, Ontario Shores, RPN, currently transitioning to an RN. This actually was part of an assignment from that transition to virtual. It's part of my placement assignment right now. It's a pretty good idea. I hope they keep this going. I would have never found it otherwise. But aside from that, in terms of family perceptions, I think one part that's been very difficult is even if you don't have an opinion on a vaccine, I quite often am pulled into the realm of referee between two others who will look to me as kind of like a fact checker in the moment. And then on top of that, just dealing with myself, I work at an infection control clinic and I collect all the COVID swabs. So even just mentioning that to somebody involuntarily, they'll usually take 2 or 3 steps back. So it's hard not to kind of feel like you're a leper at that point. But it's just involuntary. I've just come to accept it, come to expect it now at this point, to be honest with you. But yeah, the impacts of the family specifically is I find myself refereeing a lot of stuff between family members and friends, and I did not volunteer for that.
I know. That's true. That's true. Someone, thank you so much for the comments. Someone asked, I think Nicolette, you asked about the 47 cents. Yes, Nicolette, RNAO, the position of RNAO is and has been for a long time, and there is an action alert, Susan, if you can put it on the chat so people can sign to repeal Bill 124 and to let the union negotiate. So we are not saying what the increase should be, but return the rights of the unions to negotiate. And that's long overdue. And today when they asked me to comment on CP24, I was live on the throne speech. I said I was hoping that the Premier will announce the repeal of Bill 124. That didn't happen, but I'm hopeful. I need to tell you I am hopeful. I'm hopeful that we will see an increase in minimum wage for everybody. Not to where we want, but we will see an increase, which is long overdue because it has been on hold for a few years since the governor, if you remember, Kathleen Wynne had an increase that was $1 per year, but then was attached to COLA, so that was put on hold. So if we were to at least do that piece, it will bring us to $16 minimum wage today versus the 14 something. It needs to be higher than that, but I hopefully the government will do something or not on that. And if not, there are elections after. And second, on the issue of nurses, and I would suggest all workers, not all public sector workers, not only nurses. It should be teachers, it should be others. I think that bill was ill-conceived to start with, and it was conceived before the pandemic. It certainly needs to be out now with the pandemic. And that's what the nurses at Queen's Park are advocating for, and that's the action alert of RNAO that I think has several thousand people that have responded, and I would urge you to ask everybody that you know, neighbor, family, when you go to the grocery store, to please, please, please ask them to fill in the action alert. These action alerts have a lot of impact.
Doris, I'm wondering if we should kind of open it up for any of those questions. The third question that we hadn't really specifically addressed was looking at how the COVID pandemic has affected health overall. So how about we open it up to the, focusing on health, but if there are any other reflections that people have about themselves or nursing, that it's just open to any of those.
So first I will comment on Nicolette. Yes, absolutely. The ODSP for sure needs to be in relationship to living wage. We are looking at the model that RNAO will put in the platform. That's one model. There are others. So you will see at Queen's Park, we are releasing the platform, Nicolette. You will see that before reflected. I just want to comment 1 minute about why I say that minimum wage will increase, because certainly no one said that at the throne speech. So that's me saying. And it's because the comment, the governor, the Lieutenant General, Governor General is in Ottawa, the Lieutenant General, when she did the remarks, she spoke about the pandemic affected different people differently, not the same. She spoke about groups that are more vulnerable than others. I tweeted about that. I tweeted about people with substance use and other aspects that were not mentioned by media. And she also spoke about people living, I don't recall the exact wording, but she alluded to the working poor in a way. She didn't use those words, and that's from where I kind of lean that something will happen with minimum wage. I'm pretty sure something will happen with minimum wage. I think something will happen with the CTS, because we were promised 21 and we got only 13 for substance use. Not that we don't need more, we need more. I think one of the most dramatic changes on the pandemic that we need to reclaim is the fact that we were moving to more community care, and the pandemic refocused us on everything around hospitals. And RNAO will be pushing still the ECHO model, which is really to strengthen community care, primary care, home care. Today, there was not a word about home care in terms of the throne speech. It was all hospital and long-term care. And while that is important, without primary care and without home care, we will be in trouble. So those are aspects to watch that we need to push. I think Mark wants to comment. He has his hand up.
Mark, could you speak a little bit louder? We struggled to hear you last time.
Sorry, is that better?
Okay, I think we started to hear you, Mark. Go ahead.
Just to answer the question that you had on how to impact health, two main things I wanted to hit on were, I believe it opened up long-term care so that the public now has very good understanding of what actually happens in long-term care. Something that I felt like has been a secret for a very long time to healthcare workers. The second would be, I think we've opened up a bit of a Pandora's box with virtual stuff. At least in the facility that I worked in, a few other friends have worked in, they're going more to virtual care sessions in terms of mental health. So things like CBT, DBT can be delivered online. And we're very nervous about how to balance that now between work and life. We feel like we've just become more accessible, and we're worried about sort of the impacts that will kind of play out.
Excuse me, Mark. Mark, do you have another, like a radio or TV or something on? Because we're hearing sort of your voice and a bit about long-term care and then something else at the same time.
No, sorry, I share an office. I'll write it out. Thanks a lot.
Oh, thank you, Mark. I heard you talking something about long-term care. Heather, did you hear more?
Yeah, no, Mark was just talking about, better understanding of long-term care and what was actually happening in long-term care. So a better awareness of the public was important, but also he was speaking about virtual care and the fact that there's some benefits that have come with virtual care, but also some challenges, and wondering, in the future, if that's necessarily the best way for all the services to be provided that we've needed to provide during COVID, and how to kind of navigate that, I think is what he was speaking to.
Thank you, Heather. I'm glad you were able to hear what he was saying, because it sounded like rich information. And I think I heard him say at the end that he might add something in the chat box. So thank you very much. Go ahead, Nicolette.
Well, thanks. I heard someone talk a little before about how they're getting a little tired of being called heroes. And I do hear that a lot from my full-time colleagues at work. And that's a real reality, isn't it? You're a hero, but like here's 3%, and so that's
not even 3%. No. Not even 1% yet.
Not even one. Oh, it's 3 over 3
years. So yeah. I think we should absolutely oppose to the use of the word hero. Yes. Period. Even in good times. We're professionals. We're not heroes. Yes. If everything is good, is what we are supposed to do. So we're not heroes. And now we're doing more than what we are supposed to do. So if you want to recognize us, do it in concrete ways, not just in words of heroes. So maybe that's a campaign that we need to do. Like the Together We Can Do It, no more heroes. And then a tagline. Let's think about that.
Yeah. And the other thing is I think that we should also change our language about vaccine receivers. And we should not call the people that don't get vaccines anti-vaxxers, because I think that puts their back up. And I think that makes them stay staunch against their position. Whereas if we say they're vaccine hesitant, that means that there's an opening still for them, and that there's perhaps some vulnerability and some possibility for them to hear and listen and change their mind. So anyways, maybe we need to change our language. And I get that from Anne-Marie Zellick, who's a GP in Guelph, who I follow. So anyways, thanks so much.
Thank you, Nicolette. And Mark, thank you for writing in the chat box about impacts on health. Long-term care homes sort of have more public awareness to the horrible conditions. Yes, that is absolutely happened. Virtual care, Mark is concerned of how we will be accessed in the future, and unintended consequences from the overuse of virtual appointments and staff burnout. So thank you very much, Mark, for adding that contribution. Doris, I mentioned earlier that I could put up the whiteboard. Should we put up the whiteboard just as an alternative for people if they wanted to respond to these questions?
Sure. I see comments though. Very good. Yep, sure.
Great. So do people know how to use the whiteboard? This is just another way that you might want to express your response to these.
Maybe an easy way is to ask people to put words.
Sure.
Words that they feel about the pandemic. I think that should be easier.
Sure. So what you can do is go up to the top of your screen and choose annotate. And then there's a drop-down menu, and you can use the text and type in words. You can also draw if that is something that you would like to do as well. And just another way as we continue this conversation, for you to respond to those 3 questions about some of the most valuable lessons of this pandemic for yourself, for the nursing profession, or for health. So see if people want to respond here, and let us know if you're having any difficulty accessing your annotate. So go to annotate, and
you're
then
looking for annotate. If you hover under you are using Susan McNeil's screen, if you hover there, that's where you'll find, click on that, you'll find the annotate.
Thank you, Heather.
I went to view options and I couldn't find it, but it's under your viewing, and then you'll find a list of options you can use to annotate with.
Thank you, Heather.
Actually, Susan, I was just thinking of the board you made for Nursing Week. And I can't quite remember now the technology, but we all put in, yes. And it turned into such a beautiful board. I was thinking we should actually do that for COVID with these kinds of thoughts and feelings. Yes, here it's coming.
Yeah, that's another option as well, Regine. And right now, I think we'll use this whiteboard, since people are starting to respond here. Resilience, being kind, patience, compassion, evidence-based approaches. Yeah, peer support.
I like that one, losses unique to each person. That is so true, you know, when we are thinking about the response to the survey that RNAO did with nurses. There were common themes, and yet every nurse experienced this pandemic in different ways. Regardless if you're working, retired, working in ICU or whatever, right? Not one life is the same as the other. So I love these losses unique to each person. I don't know who put it, but it's so meaningful. All of them are meaningful. That one just is profound, right? Learning to do things differently opens up new possibilities. No doubt. I need to say, my biggest achievement, aside of anything else that people may think, is no more paper almost, to the degree that I cannot find a pen in my house. Like I cannot find a pen because I got so used now to everything online, Zoom online, this online, the other online, the whiteboard. No pens now. The importance of peer support, the importance of neighbor support. You know, we had a good relationship with neighbors before, but now everybody brings from their garden I cook crepes and I give to all the neighbors. Everybody does something, right? It's the need to connect, the beauty to connect. Characteristics are values, one day at a time.
And there's some comments in the chat that Corsita says, my pride as a Black nurse and working on the Black Nurses Task Force at RNAO.
As the co-chair, Corsita.
Mm-hmm.
Thank you. Thank you for that amazing work.
And Stephanie says importance and openness to technology, I believe. Was that what it said? And innovation.
The importance of advocacy, look, over there. I think it's true. I think nurses realize more than ever before the importance of advocacy. Yeah. Yeah.
And not everyone is treated equally. I think that's really been something that we've all become so aware of during COVID.
Okay.
Yeah.
Who's this drawing? How beautiful.
I think it's reflecting the gardening that's happened.
That's good.
Someone is drawing this lovely border. Amazing. I like this, choosing your battles, acknowledging all people, not all people think alike.
And I sent you an email.
Keeping things simple. Look at that. That's good.
Are you able to give me the same rate for a 35-year fixed?
I think that you need to put that phone off by Olivia, so we don't hear all the private conversation.
Because you have me approved for a
Olivia.
5-year fix with a 25-year AM.
I don't know if Olivia can hear me.
Hi, yes, I can. I can't see if he's unmuted.
Thank you.
Just remind everyone, if you're not speaking, please.
Letting those you love know how deeply you feel for them. Wow, beautiful, beautiful, beautiful.
There's so many messages in the chat, keeping an open mind and not being judgmental. And then my most valuable lesson is how valuable nurses are. I always knew this to be true, but strength, knowledge, grit, etc. nurses are showing on social media as a daily lesson for me.
Yeah, yeah.
Keep going, don't quit. Yeah, we need that.
I think we also need to be patient with nurses being judgmental. I absolutely do. I put myself in the shoes of nurses that have begged people to get vaccinated and that then need to be taking care of people. Like I'm thinking about the people in Alberta every day because nurses and doctors they just don't know what to do, right? And I have a lot of patience when they become judgmental too. Not judgmental about the care, they still give the care, but they become very upset. I cannot picture, well, I guess I can because I work in the war. You always can picture, but just picture what they're going through. It's brutal. And Saskatchewan is even more brutal now, guys. Like we have it, let's keep it this way, right? Pretty good here in Ontario at this time. It reminds me what we went through with wave 1 and 2 in long-term care. They're going now in ICUs that way. They're exhausted beyond belief. And when people are exhausted, you know, yeah, they react, and it's human too. They're humans too. Yeah, I heard some doctors speaking in the television about that and made me reflect on them.
Elizabeth, do you want to say anything more about what you wrote in the chat box, working together to come up with strategies to confront future challenges to humanity? That's interesting. So you're looking at this learning and what this means for our future. Is there anything more you want to say about that? You mentioned natural disasters. other pandemics, I guess, and inequities in the world. I invite you to speak a bit more.
Well, and if I can add to that equation, climate change, which is bigger than all of everything that we have experienced, right? Yeah.
Yeah, and Marianne is saying, knowing when we're tired or weary, recognizing that, I guess, and then responding with gentleness, which is probably not really easy if you've worked past your 12 hours or like Doris said, the scenario if you're taking care of someone who has chosen, not to be vaccinated and they're very ill. Yeah, very difficult.
Yeah, yeah. And those that will come in next, which will be even more difficult, I think, is with children. Children in ICUs that get the disease, and they're already happening in Montreal, in Quebec, right? That are getting the disease because of unvaccinated family members. Yeah, and nurses that have brought it home to their kids, by the way, because of patients. Like, just picture that, right? It's a very difficult human situations that our colleagues are put through in the front lines. Most of us keep the patients, but once in a while, everybody's human too.
Roberta made a comment, as a non-COVID patient getting surgery during COVID, family drop you off at the hospital door and are not allowed to visit, very isolated.
Yeah. Right. Well, and that's, imagine if they're lucky to get the surgery.
Exactly.
And picture the many that have been postponed with cancers, guys, with all kinds of conditions.
Mm-hmm.
Yeah, yeah.
Someone in Saskatchewan was mentioning that last night on the news, that we really need to get this message out to the public. They need to know what the downside is of the kind of laxness that seems to be going on in Saskatchewan.
Yeah, yeah.
And it's the nurse who is the shock absorber, the conduit between patient and family, adds to the burden for the nurse.
Yeah, yeah, yeah.
Actually, Marianne's made a good point about thank you to our Canadian military nurses. I think one of the other things about COVID, it has shone a light on the nurses in the military that I don't think we really think a lot about or appreciate their role. So thanks for raising that, Marianne.
Yeah. And the ongoing life practice probably of teaching each other with respect, regardless of different opinions. Thank you, Hagar, for that.
Yes. Naomi, you're so right. The second really pandemic, the dramatic increase of addiction, for sure. And then those experiencing homelessness, mental health, depression. Yeah.
Elizabeth, do you want to say anything more about this? You're talking about a webinar about small practical strategies for future planning, like timeline preparation, 7 days to get lockdowns in place, 3 days to identify spread, 1 day to public health measures in place, as examples, or anyone else in terms of what we've learned from this pandemic that can help us
So I can comment, given that I was involved before even day one, right? Because RNAO actually was the one that called the minister after our medical officer of health was not responding to the need to meet daily. And we did get it in terms of starting at least to meet. But it is naive to think that even if we plan, that things will happen as planned. Best case scenario, they will happen close to what's planned. Worst case scenario, which is usually what happens, is that there is lots of politics of it. Lots of politics. The degree of politics in the first and second wave here in Ontario was brutal. Nothing was driven by evidence. So I would say to Elizabeth's comments, the importance of having top leadership in all the positions that are needed. I'm not talking about politics because the politics is elections, period, right? But in the chief medical officer, in the this position, in the that position, the importance of having, and if I have one regret, and I have been public about that and it's in documents, is that in January of 2020, when I first spoke with the Premier and the Minister about the need to change our Chief Medical Officer of Health, I was convinced otherwise. And probably, I don't know if we would have done anything, I should have gone public that day versus waiting another month or whatever, because anyways, it took a long time until we changed. And I am convinced today that if we had had someone like Kieran Moran in his position early on, from day one, we would have done better. Because I can tell you with certainty that the Premier was lost in the sense of knowledge of a pandemic. Any Premier would have been lost, guys. Any Premier, unless he's a health professional, would have been lost. Many of us were lost, right? But if he would have had back then the guidance that he has today of a strong chief medical officer that knows what he's saying and has the capacity to convince versus a Doris calling him on the phone, which it helped. But you cannot underestimate or overestimate the importance of the role of the Ontario or etc. Chief Medical Officer of Health. And the proof is in the pudding with Ontario today versus Alberta. Proof is in the pudding, right? It's there. It's naked to the eye. There is no reason why Ontario, that is a humongous province, is doing much better than Alberta today, except that we have all the right players in place. And that includes the Ontario Chief Medical Officer of Health. So when we talk about Elizabeth's question of preparing, I think that needs to be in the equation. Do we have the right people leading the orchestra everywhere that needs to be, right? Because I mean, I hope we will continue to do this well, but if you go by the throne speech, basically the message was, we are staying the course. And it's the same Premier, guys. I'm not excusing the Premier. I'm explaining only that the role of the Ontario Chief Medical Officer of Health is critical, as it is of all the Chief Medical Officers of Health in the public health units, right? And that's one of the learnings, because remember, before the pandemic, cut to public health, you know, and public health, you know, they have shown if the vaccines would have been given to public health from day one, probably even that would have been even stronger, because since they took it over, it's doing beautifully, right? So it's learnings, right? It's learnings about don't mix politics and evidence, and what do you do to not mix it, right? And those are the roles in the different places. Yeah, but it's not easy, right? It's not easy. It's not easy to, I can understand why they convince me otherwise, the night that they convince me otherwise, because everybody's afraid to change course when you are in the middle of a mess. It was a mess, right? So, but I'm glad we did. Mm-hmm. Yeah.
So Doris, I saw the, I don't think there are any new comments in the chat box other than Elizabeth confirming that the RNAO's voice has been really essential in putting actions into place. Thank you for that, Elizabeth. So I'm not seeing more comments, and the whiteboard, I think we filled it out really nicely, and there weren't any more additions there. So maybe we'll move to kind of where we go from here, and perhaps even revisit what we started off with the conversation. We talked about a hiking group, we talked about a recipe book, we talked about a choir or a band, or maybe there's some other thoughts since that earlier discussion that we want to talk about where do we go from here.
If we can ask people if they can put in the chat, first of all, because this feels to me a bit, and I say it in very good, in good ways, in good terms, it feels to me, like almost a group therapy group. And I say it in really good feeling, because I think we all need this. We all need to vent. We all need to find the silver linings. We all need to feel together, right? But maybe that's just my feeling. So if people can put from 0 to 10, because I don't think you have a poll, right? And we should probably in the go forward have on each one of the webinars a poll of overall rating, right? How good it was for people. Is this something that is helpful, or do most people think that it's not, right? I mean, I see most people state, so it lets me think that yes, but I don't know. Can we hear before we...
So Doris, just to clarify the question, is the question about, is this webinar helpful, or is the question, how are the group? Okay.
Yeah. Was this, because it was free flow, right?
Yeah,
was free flow. So was it helpful?
Yeah, so you're asking for a scale from 0 to 10, 0 being not at all helpful, 10 being extremely helpful.
Be honest, you know, whatever people feel, yeah.
We have a 10.
And feel free to write in the chat box, you know, any suggestions you might have. This certainly is a different approach that we've taken with this webinar compared to past COVID webinars when we've had a bit more structure, more topics, guest speakers, and that kind of thing. So today was a bit more of a looking back kind of reflection type webinar. So any comments are welcome, and feel free to add your ratings. Thank you.
I like the comments. I like a colleague that wrote, it feels like a debrief to me too. You know, I was thinking before, I would like to have a good cry at some point. No, really, I mean it. I mean it. It has been brutal, right? And it's so much on the go that you don't even have time to kind of process and just be fed up with it. Have a good cry and then keep moving, right? You know what I mean? And I do think, the raging grannies, and here you go. And I think you're right. That yes. And I do think that at some point we need to, I think this is what we did today, actually. Yeah, I'm reading, I'm sharing. It feels good to me at least. Thank you, colleagues, for allowing us to feel good to yeah.
Yeah, those are nice comments. We're in this together. Yeah.
It's Barbara speaking. We talked a little bit about music and a song, but years ago, there was a nurse for her master's degree. I believe she practiced at Sunnybrook. She used her flute with patients who were experiencing cancer. And she composed a piece of music at the bedside with the patient to capture in a written piece of music that person's experience. And then she played it for the person on the flute, and then she gave them the score of that unique piece of music. So I think about Doris's comments about a good cry. I think using the arts in this way to create a piece of music to maybe collectively express the sorrow, the suffering of nurses through the pandemic would be something personal to nurses and perhaps healing in some way.
Yeah, yeah. You know, you talked about the nurse at Sunnybrook. I'm trying to remember our colleague that has a PhD. She worked at Sunnybrook, but then she worked at rehab. And she herself had a stillbirth child. And, oh, she's very well known. She also used a flute. And we can connect with a couple of these colleagues and with our colleagues that sing here when Raul does the piece and do a session. Because for some is music, for some could be art, for some could be talking, for some could be cooking, but really it's the use of other ways to decompressing and to feeling together and to debriefing our pain, because there are many silver linings. There is also pain, like 2 years, guys, right?
Mm-hmm.
Doris, you mentioned earlier, you know, kind of the together we can do it, which doesn't seem to fit right now, but, and Ermagine had mentioned the Padlet. You're not talking about, you know,
no, I wouldn't
musical.
do it together. I wouldn't do the together we can.
Yeah, no, I'm just thinking.
But I would use the together we can do it for No More Heroes. We need to mull it over, right? And yes, it is Christine Jonas, and she's amazing, 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 amazing. She has, by the way, she has written children's stories. She's amazing. She still goes every year to the grave and with her son. She has a son or a daughter, and she's remarkable. So we could connect with them. What's her name from Parsi, Imagine, CNS. She was at Sunnybrook. She was the chief nurse for a while. And she was, she now does art, theater. That's what she does, theater.
No, it wasn't Carrie Marshall, but
no.
She was the exact opposite.
No, she was, it will come to me. She was also the chair at York for a while. It will come to me. But Susan, I was talking about No More Heroes. No More Heroes. I think one of the, Gail Mitchell, here you go.
Yes, good for you, Conchita.
Yeah, so I think this issue of heroes is getting to people. It certainly has gotten to me, but it got to me even before. I never thought that they should call us heroes. But I think nurses in the front lines had it with it. They had it with it. They don't want to be heroes. They want to be treated with the respect and recognition, financially, workload, and otherwise that they deserve. So I think we can develop a whole campaign, Susan, similar to what you did with the Together We Can Do It on this issue with our comms department, and involve the nurses that are involved with the nurses with the signs and all of that. So we bring the nursing community together and involve also the managers and the chief nurses and everybody, because one of my concerns when I look at some of the tweets is it's because people are exhausted, but still we need to be really mindful, is not to separate or not to undermine one role in nursing because of another role, because everybody had it very difficult in all sectors and in some sectors more than others. But this can help us bring together, right? And maybe it will be the closing remarks of the pandemic, or maybe us telling the pandemic, go away, no more heroes for you. Because it was together we can do it, was kind of inviting this pandemic. Now we need to kick it out.
Well, or maybe we substitute it with something, because one of the things I really feel with all of the pictures of the complexity of the care nurses are giving and the comments by nurses, the public is finally getting it, that we are a knowledge-caring profession. And I think we have to really leverage that and talk about that more. So we're not heroes. We have saved the day because of our knowledge and our care. Something to that effect. But replacing the hero with okay, what are we?
Yeah. Well, we are, but then what is it that we are asking, right?
Yeah.
Not claps anymore.
No.
I like the comment of our colleague that said, I have found the nuts and bolts approach of past RNAO webinars to be quite helpful, but today's session was a much needed and necessary mental health day. Remember, this is Mental Health Week, guys. So wow, this was so apropos. So,
it was timed.
Yeah, so a mix of, right? A mix of types of webinars. Very good.
So Doris, just you were speaking about what do we want. So I put up this slide that shows our different action alerts. So if you want to speak about that for a couple of minutes before we close.
So let me tell you, I will talk first what we want for nursing, which is not all covered here, and which will be a guiding principle in our platform for nursing. We're asking 3 things for nursing, just so you know, in simple words. The first one is do away with Bill 124. There is no conversation that can happen for the profession with any party. And remember, it's a policy platform, it's about elections. There is no conversation that can happen without Bill 124 being gone. So that's one, got to be gone. Number 2, is the issue of, and then of course, with that goes that unions have a right to negotiate the right compensation and benefits, right? So that goes there. Second, workloads. Nurses in any category, in any role, cannot continue to work with the workloads they have. They just can't. They just can't. They did it for 20 months. By the time we're done, will be 2 years. They simply cannot, and it's not only because they cannot for themselves, but they cannot for their patients. Patients and nurses are talking about that. You may or may not have seen them in the television with the face cover because they don't want to disclose their names. They are seeing patients dying because of deficient care, because of insufficient human resources. And we cannot hide it from the public. We are doing a disservice to the public hiding, thinking that a nurse, an RN, can take care of 2 or 3 ICU patients the same as she or he can take care of 1. Impossible. It's like reading 3 Kafka books or 2 Kafka books at the same time and processing everything. Impossible. And no one will stay in their work if they don't feel that at least 70% of the time they're doing good work or decent work. You know what I mean? Why would they stay if they feel day in and day out that they could not, and I'm not talking only about the important things like holding a patient's hand or smiling. That goes to me without saying. I'm talking about even urgent things that need to happen to patients. They cannot do them. So that's the second. So Bill 124 gone, negotiate for the unions, workloads, and then the third is building careers for nurses here in Ontario. And the same goes for Canada, by the way, but we don't have that jurisdiction here in Ontario. And that means more nurses coming into the profession, which the government, to their credit, did listen to us, and they increased enrollment of RNs and RPNs. Now we need to continue to push the NPs. And second, bridging programs, right, left, and center, guys. Morning, evening, night, weekends, because nurses have complex life. If they are a PSW, they have even more complex lives because of the earning. If they are RPNs, they have complex lives. And if they are RNs, they have complex lives. We continue to hear that an RPN that gave birth or a PSW that gave birth last week needs to take the spot next week for the program, because if not, loses the spot. That is not normal. That is just not normal. And so why wouldn't we have more bridging programs, right? And we need to bring back what we used to have, which is prior learning assessment. If someone practiced as a PSW and was an excellent PSW for 10 years, and now was accepted to an RPN or to an RN program, give credits for at least some of it, right? So that will bring, and then instead of bonuses, my colleagues, some don't like this, but RNAO does not think that bonuses are helpful, because today you come to this bonus, tomorrow you go to another one. Pay for certification. We need so many more nurses in ICU, so many more nurses in step down, so many more nurses in long-term care. Pay for their certification in lieu of them signing with you to stay for 2 or 3 years, whatever that it is. And then we will build careers in Ontario. People will not want to leave, because let's remember, we have in Ontario things that nobody else has. Reimbursement, $1,500 a year that people can do. In other provinces, they don't have. Full-time guarantee for new grads, no one else has. BPGs, granted, they're used around the world, but nurses in Ontario feel huge pride that they're done here. Like we have the advanced clinical fellowships. Like I can go, we need to rah-rah those pieces that we have. We don't rah-rah them enough, and they're a magnet for people here. So we need to augment with new initiatives, and we can be in a better shape. We can be, and we need to be in a better shape. That's for nursing. For the rest, we will continue to focus on vulnerable populations. I mean about RNAO. Yes, we will push for a refocusing community care through the ECHO model, but within that, we will continue to focus on Indigenous people. We will continue to focus on people with substance use. We will continue to focus with people that experience homelessness, because we have power, that's why. And RNAO needs to use the power for what's good for vulnerable populations. The rest of the world will figure out how to manage better. You know what I mean? Hospitals will always figure out, and I'm not saying that with undermining, because I think hospitals are critical, but they will figure out. But the vulnerable populations will not. They don't have the power. They don't have the power. So we need to. So that's why you see there the nursing home basic care guarantee. We will keep pushing for that federally and provincially. That's why you see here the issue of truth and reconciliation. And you listen to that speech today from the Lieutenant General, when she spoke about what this province will do, is about reconciliation. And the Prime Minister did exactly the same. And there is the difference between truth and reconciliation, guys, and we need to educate ourselves way more about that. But when people speak only about reconciliation, it's one piece of the pie. Truth means what happened is real. The court ruling against the kids that have received less money for services that other kids receive more, and that now the court ruling said 40,000 per kid. That is truth. That is truth. And we need to push both from an RNAO perspective, truth and reconciliation, right? Because there is no reconciliation without truth. And nobody said better that than Chief Archibald. Listen to her. And she pointed that, and I went, wow. So we need to educate ourselves and follow the lead. And we have now an interest group under Rachel that is amazing, and she can teach us, and all of them can teach us. And we have the same with Corsita and Angela for Black nurses in the task force, but also the interest group, right, with Daria and Dania. And we will push for equity within nursing, and we will push for equity in the broader world. So stay tuned. The website, you are going to see the website in the future, much like the tiles that Susan put here, but next time we can do them with the actual layers, Susan. The first will be nursing. The first will be equity and nursing equity and RNAO, or RNAO and nursing equity, and it will have a tile about indigenous nurses. Then we'll have a tile about the Black nurses, and they will have a tile for LGBTQ2. And then the next layer will be broader issues, and it will be about long-term care, because this time, well, we never gave up on it, but this time we're going to stay like a dog with a bone until we see that we get what we need for long-term care. And we will look also at the opioids crisis, and we will look at nurses and well-being. Those will be there. And then nurse practitioners that are a key solution to the system, or health human resources overall, RNs and NPs, etc. And then at the bottom, and for that Susan will invite us before we close today, there will be a leading change, RNAO and leading change. And how will it change across the board, and how we educate everybody in leading change through the new toolkit. Susan, I will leave it for you to invite.
Sure, thank you. And maybe Olivia can put the link in the chat box. So this is actually tomorrow. We hope that there's still time to register for this. This is the official launch of the Leading Change Toolkit. We're delighted to release this to Ontario and the rest of the world. This is for change agents and change teams who want to make a lasting impact using evidence in their organization, the healthcare organizations. It's featuring the two complementary frameworks, the knowledge to action framework that many of you have been using for a while. You've been using previous editions of the toolkit, and the social movement action framework that we have been using for many years, but is official and has been, we've done a lot of great in-depth work in articulating what that is. And the toolkit is going to have all kinds of resources, tools, evidence, updated evidence, worksheets, and things for you and your teams to use. So it's going to be on our website starting tomorrow, but please join us in the webinar launch.
And maybe the next webinar, Susan, can be about presenting the themes a bit and having the colleagues from Indigenous theme, because it's both home office and interest group, etc. And also for the Black nurses to come and present. Maybe both of them we can present and get feedback from people. By then they will be, I think, out already, but still it will be really good, right?
Great. Okay. Yeah, that's a good idea. So we'll work towards that. And maybe at this time, because I see that we're at time. So I'd like to thank everyone so much for joining this discussion. This was sort of a unique webinar. I'm seeing that it has been valuable for people to have this debrief and kind of a more of a casual conversation. Thank you so much for your contributions and your artwork and your thoughts and your words. Thank you for, in advance, for continuing to advance the work that we are doing in Ontario to advocate for the most vulnerable groups and signing our action alerts and being politically involved. So continue to use your voice and work with us in leading change moving forward. So thank you, everyone.
Thank you.